Hi, everyone. Good afternoon. Good afternoon. I wanted to give it a moment for everyone to be able to get in to our meeting before we start it. Right. All right. Good afternoon. I would like to welcome you to Element's Open House, introducing Element by Arkhe. My name is Shaun Cox, and I am the member manager of Element. On yesterday, our country celebrated the life and legacy of Reverend Dr. Martin Luther King, a personal hero of mine. His example of faith, love for all mankind, and his willingness to sacrifice for others and causes greater than him are a guiding light for me in my career. His quote that life's most persistent and urgent question is, "What are you doing for others?" is a message that my parents constantly spoke of in our home. It is in that spirit that I introduce Element. At Element, our mission is to empower healthcare providers with innovative tools and supportive network to enhance patient care and operational efficiency. And what does it look like to deliver innovative tools and a supportive network to enhance patient care and operational efficiency? It is in the capacity of Element's team, who you will hear from soon. Element recognizes the challenges faced by providers, and we are uniquely positioned to support providers that need assistance with compliance issues, monthly training, and technical assistance opportunities with the goal of increasing capacity and technology solutions that will improve data collection and a host of other solutions, all with the goal of improving outcomes for the patients, the lives that the providers touch. Through Element, providers will collaborate, share resources, vertical integration, and capacity to ensure a value-based care model. Providers that are historically underutilized experience a lack of access to tools, support, resources, and technology. Element exists to eliminate those barriers. To do this, Element must look like the community we serve. We will have staff with the capacity to reach into our rural communities, our Black and Brown communities, our elderly, veterans, wherever we need to be to help enhance provider services, you will find us. Element will have a robust and nimble team that will be charged with expanding our reach to the underserved communities in our geographical footprint. I'm reminded of a verse. The first question, which the priest and the Levite asked, was, if I stop to help this man, if I stop to help this man, what will happen to me? But the Good Samaritan reversed the question. If I do not stop to help this man, what will happen to him? Now that you know what Element will do, I want you to meet the incredible team that is partnering with me to deliver services to our community. Thank you.
Good afternoon and welcome to our virtual open house. Jawanda McNair, and I'm Director of Operations. Today, we are excited to introduce to you the future of healthcare integration. Welcome to Element by Arkhe. Our agenda is as follows. We had an opening by our Managing Director, Mrs. Cox. We're going to continue with an overview of our network and also our membership and services by myself, Jawanda. We'll have a presentation from Lindsay Taboado for our Sunwave software solution. We'll have a demonstration as well from Frank DiMarco with MediSked for our software solution. We'll also have a conversation with Jason Cagle, about our software application and support. We'll have a discussion and feedback session led by Dr. William Edwards, and we'll have some closing remarks from our Managing Director, again, Shaun Cox. So who are we? Element by Arkhe, a clinically integrated network. So you may ask yourself, what is a CIN exactly? A clinically integrated network is a collaboration among healthcare providers that enhances quality while controlling costs. It's designed for everyone involved in the healthcare journey, from the individual practitioner to larger scale providers. Arkhe is a part of our name. Arkhe is an ancient philosophy that signifies the beginning or the essence of everything. That's what we strive to be in healthcare, the essential starting point for innovation and integration. Element is located in Charlotte, North Carolina, and we serve the entire state of North Carolina. Our mission is to empower healthcare providers with innovative tools and supportive network to enhance patient care and operational efficiency. Our vision is a unified healthcare community where every provider thrives through collaboration and access to transformative resources. So again, ASCEND, the formal definition, a clinically integrated network. It's a formal group of healthcare providers working together to deliver efficient, affordable, and coordinated patient care. Both are characterized by a network of physicians, hospitals, and other healthcare providers voluntarily working together to improve care and also lower costs. And who was ASCEND for? I dare say it's for you. Element is directed towards organizations that are small businesses or historically underutilized providers, either independent or employed. This is what we know. Healthcare is changing for patients as well as providers. Chronic diseases are rising and can be avoided. The cost of care is rising. There's a disconnection between providers treating the same patient. Emergency room visits are high as well when health conditions are not properly managed. Medicine is becoming more specified and therefore independent. And community providers will become a primary location of care, not hospitals. So how can we assist? We have several membership benefits that can support this change in our healthcare environment. First, we have individualized coaching. We also have support with data and quality and compliance. We provide training and education. We have health information technology. There are partnership availables that we are grooming. And also, our goal is to create a community within our network. So the healthcare industry is evolving rapidly, and Element by Arkhe is at the forefront of this transformation. We offer cutting-edge software solutions that resolve the complexities of compliance in healthcare management. Let's dive deeper into our software solutions. First, we'll start with our EHR, Element powered by Sunwave, and that will be navigated for us by Ms. Lindsay Taboado.
All right, thank you so much for that introduction. I am super excited to share with everybody today who Sunwave is and how we have partnered with Element to really bring this to you. So first thing I'm going to do is just kind of tell you a little bit about what we are, who we are. Now, Sunwave is what we call a single platform. You brought up some great points in regards to quality assurance and compliance. That's really what we want to focus on as well. So we are patient-centered, but also results-focused. We are an end-to-end platform, meaning the moment that you touch base with a patient, all the way through into documentation, as well as outside into your billing, this is all connected on one single platform. This is going to help with optimizing referral relationships, increase patient satisfaction, as well as lower denials, just to name a few. So what are we going to go over today? Now, obviously, showing you Sunwave, I could probably spend an entire day going through the benefits of Sunwave, how we're really going to optimize those relationships, as well as streamline communications. But what we want to focus on today is a nice high-level overview, going into what that initial contact looks like, into your admissions process, medical record documentation, medication and authorization tracking, and then finish off with revenue cycle management. So with that, I will get started into our system. So right here, we are looking at Sunwave. Now, when we are communicating with our patients, I'm going to say things like CRM, which is that client relationship management tool. That's really where you're going to start first. So the moment that a patient calls in, this is where we're going to begin that documentation. We're going to place in who called in, how they found out about you, their information. Now, because we are a single platform, if this patient was ever with you previously, you don't have to go and repeat information. You'll notice here with Aaron, we can see all of the information is there because he was with us previously. Additionally, we can see when they were with us, how they discharged, and if there's any additional notes from, let's say, the clinical side or even the billing side, letting us know important information so that we are not taking in a patient without knowing that, for instance, patient was violent with staff previously. Now, once that patient's entered in, we are able to begin the process of getting them in the door. Now, this admissions process shows our verification of benefits, our pre-screen, and our schedule priority. Each of these stages are going to have notifications that are going to go out to the proper people or individuals that are responsible for each of those stages. Now, once they receive that email and they come into Sunwave to begin the process of our verification of benefits or any demographic information, all of this will be readily available to them based off of their access. So as I go through, all of these documents, keep in mind, these documents were standardized with mental health, SUD, North Carolina requirements, but we can always further individualize each of these forms based off of each individual provider. So keep that in mind. So now as they're going through, if let's say you do need to reach out to a patient prior to them walking through the door, and you want to make sure that you're getting some of those key points of information, whether it's things like maybe a driver's license or an insurance card, whatever the case is, we've developed our patient engagement. So our patient engagement allows you to create an envelope. This is going to go directly to the patient's email. You can label this whatever you'd like, and you can include any documents that you see fit based off of the documents within the system. So here we have our driver's license. Now, I did put together one that was already placed together previously, so you could see an example of that. Now, the email will look something like this. They can access it on a phone, on a tablet, on a computer. It is a simple link that will reroute them to their own verification stage. Now, as they place in their last name and date of birth, you'll notice that this is not a user profile. This is not a login. They don't have to download an app. Everything is going to be accessible with that last name and date of birth. So now as they come in, the form is going to access as if they were in the chart themselves. So they can go in and they can begin documenting, they can add in additional information, but the moment that they sign off on this, they will not have the access to that form unless you grant it back to them. So you can send them all types of information that you need to be filled out prior to them walking through the door. Now, once that information is signed and completed, it is going to feed back into Sunwave. It will not come back as a PDF, so don't worry. You can still make additional edits or changes should you need to. Now, once the patient has moved through the process of their admissions flow, this is where you're going to have your intake process. So with the intake process, you'll be able to see any additional forms that may need to be overlooked. Maybe we need to make sure that our face sheet's completely filled out. So prior to hitting that admit option, you can always take a double look, make sure that you're adding any additional information. Once you hit that admit, what's great is all of the information that was completed prior is going to transfer over. So if you did get demographic information, pictures of licenses, insurance cards, whatever the case is, all of that is going to flow directly back into the EHR. So you don't have to worry about copying and pasting or having PDFs. So as we go through, again, I'm not going to go through every single document. Like I said, I could be here all day showing you Sunwave, but I'm going to focus on some key elements as well as features and functionalities. So as we go into the chart, one of the biggest things is making sure that there is a streamlined flow of information. So as I go into my biopsychosocial, you'll be able to see that I have substance use history. Now, we see this come up a lot. We see it in pre-screens, psych evals, biopsychosocials. Now, with a click of a button, I can actually pull over the information from my pre-screen into this form. So I don't have to worry that I'm going back and forth while speaking to that patient. I simply copy that over and it appears. On top of that, I can still make additional edits because let's face it, when I speak to the patient, Hours before, maybe there was some information they forgot about or forgot to mention. I can still make edits. And if you look in the upper right-hand corner, it says success saves successfully. That's because the system is saving while you're working. So you don't have to worry that you're going through a 2-hour bio and you forgot to hit a save button and you logged out, because that will never happen. Everything is going to save every single click. And that is all trackable and traceable. So you never lose information in Sunwave. Now, on the topic of assessments, keep in mind, we have everything all ready for you. And these assessments are reportable. Now, as we travel into our documentation as far as our treatment planning goes, as well as group notes, I'm going to take a look at our master treatment plan. Again, this is going to be that format based off of that standardization for North Carolina. So we can see here, we have some documentation pieces, diagnosis, safety concerns. But as I get down here into our action plan, you'll notice when I select action, I actually have a template for borderline traits. Once selected, it is automatically going to pull over what the problem is, my goals, objectives, and my interventions. Now, I can go through and say, well, this particular one does not apply to my patient. I can even go in and make additional statements. I can also add any statuses, comments, target dates, all of that information within this section. So even though this is a templated master treatment plan, you can further individualize the information based off of the requirements for each of those patients. Now, as I go through, group notes is probably the most widely used, as well as most important documentation that you are going to use. With our group notes, we can take your schedules and we load them into the system. Now you'll notice here, I have a schedule for outpatient. I also have a schedule for inpatient, and I have a session of social skills. Once added, it is going to scan the entire system. It is going to take a look and see which patients are assigned this particular session. Now you'll notice I already have 3 patients assigned to this session. Should one of them maybe be sick or not be able to make it, that's no problem. I simply remove them and I can create an absentee form. Now, as I go through, you'll notice my behavioral objective is also templated. Again, I can go in and add in additional information. So I can make those edits, make those changes. We also have patient individual attendance. So if, let's say, Aaron is 10 minutes late, we don't want Aaron's time affecting Chucky or Rachel. So everything below is all individualized based off of that individual patient. So their attendance type, level of participation, all of these check boxes, and clinical impressions. So you don't have to worry that even though, again, you have templates to use, you can also individualize each of these sessions. And once you're done, you'll notice sign all forms as user. I simply place in a code, and it is going to apply my signature across the board to all of the patients in the group. So I don't have to worry that if I'm running a group of 20 patients, that I am going to miss a signature should I go through that manually, because that won't happen. Now, coming back into the patient's chart, one of the things that we frequently talk about is medications. Keep in mind, we do connect to e-prescribing through Doctors First, so that won't be an issue. And we can even take any of your medications and create different templates. So if there are medications that you are using frequently, we can add in taper templates for those higher levels of care. We can also create different protocols. So if there's a mixture of regular orders versus PRNs that are combined together, we can add those as well to make sure that we're streamlining this and really making it as easy as possible for your team to add in that information. Now, before I go into the billing piece, one of the biggest pieces that connects to our billing is an authorization. Now, authorizations live within our chart. So you can document all of your authorization information based off of what service you're rendering, how many visits, units, as well as how long that authorization is for. All of this information, again, talks to reporting. Now, not only that, we can make sure that your team is staying on top of this. So you'll notice we have this authorization ending on 1/5. When I come into my authorizations review caseload, as a UR reviewer, I can come in and see who is due, what is due, and if we need any additional information. So here I can see that a note was left. We need additional information to support a residential level of care. And again, this is all authorization based, so it's going to be based off of whether you are doing this for an inpatient service, an outpatient service. It's all configured based off of your services you're rendering. Now, being that authorizations feeds into our billing, this is a perfect segue to kind of end our demo with our billing. So as I come over into the census, you'll notice I have some gray bubbles, red bubbles, green bubbles. Everything here is telling me a story. Number one, it's telling me all of my patients a part of my current daily active census. Second, it's telling me what services I'm authorized for. So that's where these gray bubbles feed into, and this is all in real time. So I brought up at the beginning of this demo that we are a single platform. This means all of the information is feeding over in real time. So when you place in an authorization or complete documentation, and that's going to be signified with the green bubbles. So the green bubbles show that documentation was completed and I can see how much time. Now, what about these red bubbles? Well, red bubbles actually tell me documentation was opened, but not signed. And I can actually access this information and I could take a look and I can even communicate with my team to let them know that they need to sign this document without leaving this section. Now, once all of this is completed, our green bubbles are green, our gray bubbles are there, the system will know what code needs to be built out from your documentation as well as your authorization. So it will automatically pull that information to be placed onto a claim form. Now, once that information gets placed onto a claim form, this gets sent out to be processed. Now, if let's say you are missing important information that is required for a claim, don't worry. Sunwave will not let you send out any dirty claims. It is going to tell you that this patient cannot be created with a claim form and why. So you can go ahead, get those fixes done, and then generate that claim. Now, with that, it all speaks to our reporting. So every patient or every payment that you receive is going to come back into Sunwave. It's going to get posted. And you'll notice with this report, this is one of our most powerful reports. It's called an ad hoc report. This is information not only from our claim creation, but also our payment posting, as well as CRM information. So maybe you want to track referral source information, as well as our EMR. So maybe I wanted to see based off of diagnosis. There's really no limit to the type of reports that you can pull within Sunwave, but this gives you a nice view of how all of that communication works. Now, with that being said, I wanted to make sure that we were able to take a look at these 5 key components. Our initial contact, so making sure we understood how to document potential patient interactions for tracking and reporting. Our admissions process, streamlining that communication from the CRM into the EMR, as well as medical record documentation. So kind of going back to that quality and compliance, making sure that accurate documentation, clear communication within departments for patient charting is happening. Then medication and authorization tracking. So tracking those medication administrations, authorizations as well in order to ensure best patient care and practices. And then finishing off with our revenue cycle management so that we can bill efficiently with direct connection from our documentation as well as authorizations, allowing for cleaner and faster claim processing. All right, well, I will leave it there and hand it back off to you guys.
Thank you so much, Lindsay, for that overview and navigating and showing us just a few of the tools that Element powered by Sunwave has to
Thank
offer.
you, Lindsay.
So thank you.
Of course.
So next up, we will take a look at our CMIS, or Client Management Information System, Element powered by MediSked, and that will be navigated for us by Frank DiMarco. Hey, Frank.
Hello, good afternoon, everybody. Go ahead and get my screen shared here. All right. Everyone can see the screen? All right, excellent. Thank you. So I'm going to demonstrate the MediSked coordinate platform, which Element, the clinically integrated network, will be utilizing to perform care management services for individuals being supported either with behavioral health needs or with IDD. So if you are a CMA that will be joining Element's clinically integrated network, this is the platform that you're going to be utilizing. Just to give a quick overview, high level before we get into the demonstration, what you can do in this MediSked coordinate platform is this is where you would be able to go access information regarding the individuals that get sent over on a weekly beneficiary assignment file from each tailored plan. So we do already have connectivity set up with each of the tailored plans. This is also where you'll go to conduct assessments for the individual, so the CMCA assessment, as well as develop the individual's care plans, whether it's an IDD plan or if it's a behavioral health care plan. This is also where you would document any services performed by the care manager. You can assign services out to different provider agencies. You'll actually also be able to bill through this platform as well. So what I want to do is start the demonstration off by showing you what an individual's more information page is going to look like. So if a care manager were to log in to the MediSked coordinate platform, what they would be able to do is they'd be able to access all of the individuals that are supported by their CMA and your CMA alone. So each CMA would be logging into this platform, the same platform. However, you're only going to be able to view individuals that are associated or assigned to your CMA. So I think that's a very important thing to know and understand. So if I were to go to our Manage Member tab here, I'd be able to search for a specific member that I'm supporting, or if I click Next, it's just going to show me all of the different members that I'm supporting. And the first screen, you're going to notice it's a list of all the different individuals that we're supporting. And then just some basic demographic information that's going to populate. And all of this is going to come over from the beneficiary assignment file. So all of this is automated. It comes over from the tailored plan, and this all gets pre-populated for you. If I want to get more granular information regarding the individual, I could access what we call is their member more information page. And this is going to be a lot more demographic information regarding the individual. Most of this that you see on the screen is going to come over from the beneficiary assignment file, but you also do have the ability to capture information that's not coming over from that file. So you'll have the ability to access or to enter additional information that doesn't come over in the file. Element also has the ability to create custom fields for you. So if there's other data that you're looking to capture that you don't see on the screen, Element can certainly add fields for that, and you would be able to capture that data. Also, anything you see on the screen is reportable. So if you were looking to report on specific information, Element has a reporting tool that they could build out reports and provide and share with you. Also, not just the beneficiary assignment file, we're also connected with each tailored plan regarding claims data. So encounter claims data, medication data, as well as any pharmacy lock-in claims. So for example, over here on the left under summary, there's a bunch of different tabs here where you can capture information. If I were to access our medications tab, over here on this tab, this is going to be any sort of medication information and pharmacy lock-in claims that have come over from each of the tailored plans. So all that information would be displayed for you here. In addition, you could also add medications. So if there's any sort of over-the-counter drugs that the individual's taking, whether it's aspirin or Tylenol, you would also be able to add those medications. And this is all controlled data as well. We are connected to what they call RX norm. So we are connected to the RX norm feed. So any medication, whether it's over the counter, whether it's prescription, you will be able to access and document on the record. And all these pages and fields are going to be access level controlled as well. So you can also have a read only, so users can log in and just view the information, or you can have users that can go in and actually update the information. And that's going to be up to your agency of how you want that to function. Other information you can capture regarding the individual is you can capture different allergy information, as well as immunizations. So if we're looking to track flu shots or COVID-19 immunizations and boosters, you could do that here through the immunization tab. Another great thing that with MediSked Coordinate is we are connected to NC Notify, where we can actually receive ADT alerts. So I know in the last presentation, we were talking about hospitalizations, and I know, Jawanda, you mentioned that earlier. So when we're connected with NC Notify, we're actually able to get ADT alerts. So anytime an individual is hospitalized, the hospitalization transaction would come into the MediSked Coordinate platform, and the users would be able to view that. In addition to receiving the hospitalizations directly from NC Notify, also we have alerts. So if a individual who is part of a care manager's caseload is hospitalized, whether they're admitted or discharged from the hospital, they will receive an alert. In addition to the alert, there's also the ability to trigger a workflow of different tasks that the care manager or the extender have to complete regarding the hospitalization. Like I mentioned earlier, this is also the platform you're going to be utilizing to develop care plans for the individuals you support. So you can actually access that by going to our planning tab. And once again, we have two different types of plans. So we have behavioral health plan as well as the individual support plan if you're supporting folks with IDD. And so everything is controlled electronically. So everything is captured in what we call the plan builder. And then based on the information entered in the plan builder, it's going to automatically generate a PDF copy of the care plan. Which is great about that is you can control the data. You can report on all of the data that's being entered. So you can report on all the different care plan data as well. Within the plan builder, this is also where you're going to go and conduct assessments on the individuals that you support. So if I click here on the assessment tab, we already have an assessment started here, and I'm going to show you what that looks like. So once you add the assessment and I click the more button here, I can click edit. And what that's going to do is actually open up the assessment. So we have our care management comprehensive assessment that's opening up here. And as you can see, it looks a little similar to the MIP where we have our different sections here. So if I were to click demographics, it's going to open up our demographics section of the assessment where all that different information can be filled out. We have legally responsible person, and we also have question dependencies. So this question right here, says legally responsible person, they're legally responsible person other than self. So this means this person has a legally responsible person that's not themselves. So if I were to click yes, what that's going to end up doing is populating more questions that you have to answer based on that response. And so those question dependencies are throughout the assessment. Based on responses in this assessment, a couple different things can happen. One is based on a response, it could generate a need, which then would require you to go in and associate a goal and intervention with that need in the plan builder. Also, it could generate a task to trigger for the care manager. For example, if we answer that the individual has not had a dental appointment within a year, it could trigger a task that lets the care manager know or the extender that they need to schedule a dentist appointment for that individual. And then once you've completed the assessment, you can go ahead and go in and finalize it. And then, like I mentioned earlier, what's going to end up happening is based on responses of the assessment, it's actually going to generate the different needs, goals, and interventions that need to be performed for that individual. And the care manager would actually access that through what we call our action plan. And what we're going to see here is we're going to see the different needs that populated based on the responses of the assessment. You also have the ability to add a member need. So if a member need that we know of did not get captured in the assessment, you could actually add that manually through add new member need. Also, if there was a need that got populated from the assessment and the individual just really doesn't want to focus on that or doesn't want to work on that right now, you could actually uncheck those needs, and then it does not have to be included when it comes to assigning that out to providers. Once you're satisfied with your member needs, you could actually go into view assignments. And when you go into view assignments, this is where you would actually go in and you can assign the different interventions out to provider agencies. So you would do that through managed service lineups. And this is where you would go with for each intervention, and you'd be able to assign that out to each provider agency. Also on the plan builder, you can view a copy of the plan, so you can view a PDF copy. We also have an addendum view, so if the plan is ever finalized and reopened and updated, the addendum view is going to show you what changed on the plan since the previous time it was published. You can also here on the plan builder, this is where you would go to establish the plan team. So this is going to be all the different supports, whether they're professional or natural supports that are associated with the individual. And then you can also determine if they're part of the plan team, also if their signature is required in order to publish the plan, and then also if they have the ability to view plan access and if they have a portal account. So what's nice about the MediSked Coordinate solution is you can set up users with portal accounts, whether it's providers or even natural supports and the individual themselves. So they can always log into our portal and they can view things like the plan. They can do messaging through the portal with the different plan team members as well. Also, you have the ability to actually submit the plan for audit. So once the care manager has completed the plan, what they can do is actually submit the plan for audit. So what this does is before the plan even gets to the plan team to review, it goes through a supervisor to review the plan. So if I submit the plan for audit, it's processing the request. It's going to take, it says take several minutes, but it's not going to take several minutes. And now the plan is in audit. And as you can see, all of these boxes over here, all these boxes are grayed out. The reason why is because the plan is now being reviewed in audit, and we don't want any changes made to the plan while it's in an audit status. From there, as a supervisor, I could actually go into my planning tab and I could audit the plan. Quick, I have to make sure I have the correct assigned care manager to pull up here. Perfect. So we have Emily Jenkins' plan. I'm going to view the plan. Once again, this is just going to show me a PDF copy of what the plan looks like. And the care manager is able to review each section of the ISP. And then once they've reviewed it down here, they can either approve and initiate a plan team review, or they can request changes. And if they request changes, what happens is they have to enter what changes they're requesting, and it gets sent back to the care manager, and it unlocks the plan. What I'm going to do here, though, is approve and initiate a plan team review. That. And now what I can do is the individual themselves, Emily. So now it's in plan team review. Emily Jenkins, the individual, can actually go into what we call our person-centered portal. And this is also where natural supports can go, as well as providers that need to approve the plan. And I got an error message because I had it open. Hang on 1 second. I will fix this right now. And then once the plan is reviewed, you could actually go into the plan builder, and you could actually go in and approve it and document the different approvals. Are you still able to see my plan builder screen? Perfect. Okay. So if I go into plan review, I can then document the different signatures that we got. And the different signature types. I can save my status. And then I can publish the plan as final. And we've officially published our plan. And if we go over to historical plans, we can see a different copy. So this plan has been opened and had updates made to it numerous times. So as you can see, every time we do make an update, there is a PDF copy of what that plan looked like at the time of that publication. And then the last thing I just wanted to show you today was your ability to also log tasks. So for example, if you were to log into NC Tracks to log a referral, you could actually document that referral in the MediSked Coordinate platform. So if you were to click log task, you can select your individual. So we'll still use Emily, for example, here. And then we have a bunch of tasks you can log. So not just for referrals, any sort of tasks. And Element can create different task types for you as well, so you can log them. But if I wanted to do a referral, so let's say I wanted to referral to SNAP. So you'd still go into NC Tracks, obviously, and document that referral. But then from there, you could actually log the task here in MediSked Coordinate. And then also you can report on all these tasks that have been completed and their different statuses. All right. I think that concludes my time. Thank you very much.
Thank you, Frank.
So thanks so much, Frank, for that demo. As you can see, Element powered by MediSked is a very robust system. It offers you many tools in order to have a quality care management program. So again, just to review, we have our two software solutions, Element powered by Sunwave for your general outpatient and residential needs, and also Element powered by MediSked for your care management needs. At this point, we'd like to have a few words from our Chief Information Officer, Mr. Jason Cagle, to speak about the support we have for these software solutions. A little bit about Mr. Cagle. Jason has an extensive background in technology and has been a strategic leader at multiple behavioral health agencies across multiple states. He was an advisory board member to the NCHIE initiative and has spearheaded many task forces to bridge the gap between clinical care and data analytics to ensure improved outcomes of care. So ladies and gentlemen, Mr. Jason Cagle.
Thanks for that introduction, Jawanda. Lindsay, Frank, outstanding job, outlining our two platforms. You guys, make my job easier, obviously. So good afternoon, everyone. Once again, my name is Jason Cagle. I'm the Chief Information Officer for Element. Those in the audience who aren't sure what a Chief Information Officer or CIO does or is, a quick explanation is basically everything technology related flows through me. But my focus is not just on the technology, but more so like how we can use it to better manage our agencies and ultimately better serve our communities. Like Jawanda was saying, I personally have had a long career in healthcare and even a longer one in technology. And, for years, technology has been an afterthought in our industry. But by now, I think all of us have heard at one time or another how we need technology in our lives, in our business and whatnot. And specifically in healthcare, we need it to be more efficient in order to reduce costs, to increase productivity, and expand our reach into our communities. So like for me, I'm excited about the confluence of technology happening right now, specifically in healthcare, but not just in how it can help here and there, but how it can change and absolutely improve it. I look at things that's happening with AI and things like ambient listening to help note documentation, to predictive analytics to improve response times to community members as stressors increase in our lives and potentially increase their suicidality levels. Even wearable technology that can predict when someone is about to have an anxiety attack. Technology has come a long, long way. And I love the focus that's happening on healthcare. So as you heard Jawanda saying earlier, if we take a look at our full name, Element by Arkhe, and focus on the Arkhe for a minute, it means the beginning and essence of everything. The coming together of mind, body, and spirit. As a technologist, I love this idea, right? Because it embraces the harmony necessary to reach our full potential. So in technology, we're constantly reach and then expand our potential. So, with that, I'm proud to be part of Element's leadership team and continue on a journey of being a transformational CIO. Like I'm currently building a team right now that's outstanding. They're here to help make a change in our communities and our communities around us. For me, like my mission here as a CIO is to partner with our community providers and help give them access to the technology, as well as technology leadership that they might not otherwise have access to. Two great examples of what you just saw here today, right? I'll absolutely help you to improve your community engagement. I read this quote once, Steve Jobs. It's, I know everybody's not necessarily an Apple fan or a Steve Jobs fan, but he was an amazing tech leader and a tech pioneer. So there's no denying that. But technology is nothing, right? Imagine that coming from him, right? Technology is nothing. But what's important is that you have faith in people, and they're basically good and smart. And if you give them the tools, they'll do wonderful things with them. Well, that's our goal here, is to give you the tools to add to your tool belt so you can continue to do wonderful things in our communities. All right. So with that, we've been pressing, trying to get everything in there. We got some more people to talk. So I'm going to step off my soapbox for a minute. I'm going to pass the mic back to Jawanda and keep this thing rolling.
Thank you, Jason.
So, awesome, Jason. And I hope you all can appreciate why he is our CIO. Healthcare is evolving and technology is permeating into every area. And so we want to use it to our benefit. So again, we offer you two solutions across, your healthcare needs, the CMIS and also the EHR. Let's take a look at some of the overview. Let's do an overview of what. So why is all of this important, you ask? A rising tide is going to lift all boats, and we hope to be that tide. We want to improve quality, technological infrastructure and compliance and data. We want to increase efficiency, streamline coordinated care and evidence-based practices, We want to reduce the cost of care and align with value-based care and support outcome-based measures. So again, an overview of all of the different solutions that we can offer you through our software. Some highlights: e-prescribe, telehealth, care coordination, documentation, and also training and resources. Let's look at some additional services that we can offer. We have network coaching. Each member who is a part of our network will be assigned an Element coach. That coach will utilize our systems to navigate your agency to excellence. Upgraded membership packages will offer provider-centric support and also consultations. We have in-house and referral or resource networks to support all of your compliance needs. And again, we also want to build a community. So we offer a unique opportunity to connect and collaborate and also transform healthcare via different partnerships. We will hold monthly QA meetings. You'll be able to participate in value-based cost sharing. We'll have in-person and also community events. We have an online and in-person training. And also we'll have provider partnership opportunities where you can collaborate with other like-minded healthcare individuals to expand your services. So training and resources, we do that through something called Element University. Let's take a quick look at it. Element University is our educational platform that empowers you with knowledge. The basic membership will include 3 core trainings. Those core trainings are going to be fraud, waste, and abuse, value-based care, and also HEDIS measures, which is going to be the platform or the essence of how value-based care is judged. And here again, you can see just a brief overview of our Element University and the courses that we have coming. So with that being said, Element has several membership packages to meet your needs. They range from Prime all the way to Platinum. In the middle, we have our Each membership, which we see is going to be the flagship service that most providers can benefit from. So when should you join Element? Well, the time is now. Tailored care management has been established to assist and bridge the gap in services. North Carolina will be transitioning from fee-for-service to a value-based care model, and tailored plans will be launching soon. So are you ready to be a part of something bigger? Join Element today and be at the forefront of compliance and healthcare innovation. Together, we'll create a healthier and more efficient future for all. We're not just a clinically integrated network, we are a movement for change. So for more information, you can visit our website, which is www.elementhealthconsortium.com. And right here, you can meet Harpy, who is our company mascot. She illustrates orchestrating healthcare's digital symphony. Excuse me. And in addition, you can also reach out to us at our Charlotte office on Moorhead Street. Don't hesitate to call us via our phone number listed there, or email us at element@healthconsortium.com. All right, and we thank you so much. Again, we're not just building a network, we're crafting a community dedicated to excellence in healthcare. With Element by Arkhe, you're investing in a partnership that values progress, compliance, and also innovation. Thank you for joining us today, for being curious, for being visionary. Together, we'll create a future for everyone, and we look forward to welcoming you into our community. Now we'd like to open up for a few remarks and also a discussion led by Dr. William Edwards.
Good afternoon, everybody. It's been a busy day today, and a lot of new information has been shared. I won't try to repeat what MediSked and Sunwave and everyone else has discussed, but I'm here today to tell you that we're the Element, that on our site, you are able to access all of the local department documentation. When we take an environmental scans of some of our neighborhoods, you can see why the people are sick. They may be living a mile from an old plant that shut down. They may be dealing with radon that's coming through from the ground because a lot of houses that was built in minority communities were built on bad land. They were bad on land that's the first to flood. And so what happens is a lot of these elements come in and they make granddaddy and grandma sick, that they got some type of respiratory issue, and now the doctors can't figure out what it is. But thank God, through all of the expertise that we have at the Department of Health and Human Services and the CDC, they finally have come up and said that the most important aspects of healthcare is dealing with the social determinants of health. That 80% of the issues that we suffer from are environmental. They deal with where we live, our transportation, how we get back and forth to work, the communities and stuff that we live in, our environment. But what we saw during COVID, it didn't make any difference where you live up on the hill or the valley. If we didn't treat COVID everywhere, then nobody was safe anywhere. And I submit to you, that's where we're headed here now as we move forward, that we're going to have to take advantage of all of the changes that the department has made, that we don't have, nobody's going to come by and knock on your door and bring you up to speed. They put it out on their website. It's our duty, our responsibility to read it, to take advantages of RFPs, to take advantages of grant opportunities, and to take advantage of this initiative. And here's why I say you can take advantage of this initiative. Many of you right now don't know what your business made today. You don't know how much work your employees have done. You can't pull out your smartphone and see how many assessments have been done, how many intakes have been done. But with these platforms, you can. And as we move more into value-based care, then Element is poised also to be a value-based care organization as well. So there's a lot of good planning that Ms. Cox and her team has done to try to be able to bring a technology platform that can really change your business, bring you up to where in that you are now a competitive provider. I would love for every provider to be able to double their business in the next 12 to 18 months. We can do that. Think about it. New rate increase, new beneficiaries coming in. And before I go, let me remind you, please take advantage in your area of the Healthy Opportunity Program. That program was crafted specifically to deal with the social determinants of health. I've been working with that program about 2 years. It gets food and other assistance out to individuals. It's a good program. The programs that the department had, primary care, to help people to stay well, behavioral health care, to help keep your mind right, all of those are designed. And what we have to do now is to develop a teamwork approach. We understand all the bad stuff that's happened. I know my wife treated me bad last year. I just hope she don't treat me bad this year, so I'm willing to give her another chance. I'm saying to you, let's give them another chance. Let's get a good buy-in, and let's turn North Carolina around. And anybody have any issues they want to bring to the forefront, please put it in the chat and we'll deal with it. I'll give it back to you, Ms. Jawanda.
I dare not take it back, Dr. Edwards. That was wonderful and on point and well put. Absolutely. And so we will open up the chat, everyone. If you do have any questions or concerns, we love to entertain those. Please put those in the chat. I'll speak a little bit more in terms of our services and something Dr. Edwards just said. Every member of our network who signs up for a package will have a coach. Your coach is sort of your compliance guide. It's your person who's outside of your agency. However, we're partnering with your agency, and we want to help you navigate through all of the regulations that are required. So if you're hitting some rough spots, you need some assistance, you need some resources, we want to be able to offer those to you. And those can include everything from adding new programs. It can include program integrity issues. And ultimately, we want to get to the point where we can even support your accreditation, licensing, things of that nature. So again, we definitely want to be that one-stop shop for all of your provider needs. So I'll check the chat really quick to see if there's any questions or concerns that we can answer before we give you back some of your day. I've not seen anything pop up. Are y'all seeing anything on your end?
No, it looks like everything's been answered.
Good deal. Well, hopefully we have provided you with lots of information to think about and process. Please do visit our website. There's also an informational download that you should be able to access as part of this webinar that explains a little bit more about our membership benefits and services. So with that being said, if there's nothing in the chat and everything is all clear, we'd like to sign off. And again, thank you so much for joining us for our virtual launch. We look forward to partnering with you and your agencies.
I would like to hold on just a moment,
Oh,
guys. I
pardon.
want to thank some of our partners. First of all, this has been a labor of love, and I just want to say I cannot be prouder of the Element team. Just referencing something Dr. Edwards said, everybody has been working long, hard weeks, months, and hours on this to bring this together for everyone. I could not be prouder. I definitely want to say we have collectively 100+ years of experience inside the state of North Carolina and outside the state of North Carolina. We want to make sure that we bring you guys, the best product ever. Everybody on the team, I wanted to make sure had a passion to make sure that we uplift providers in the lives that they touch. And I can say here today that we have completely built that team today. I personally want to thank Element's partners, Alliance Health, Sean Schreiber and Rob Robinson, DHB, Ms. Gwen Sherrod, DMH, Secretary Kinsley, and Director Kelly Crosby. I thank you guys so much for your support with this. Giving us this opportunity to build this and be here today. Resource Connections, Latanya Hardy, the Minority Provider Association. Ms. Hardy, I want to say we are taking them by the hand. I know that was one of your favorite lines at I2I, and we will be taking them by the hand, and I appreciate all of your support and everything that you've done. Definitely our data partners, we cannot be, I would be remiss if I did not say thank you to MediSked, Doug Gottlieb, for sure. Thank you, Frank, today for the demo. Sunwave, Wayne Johnson, and thank you, Lindsay, for your demo, and Jellyfish John Burnett, who gave us our amazing graphics and website. I definitely want to give you an amazing thank you for that. As I close, I want to finish the way that I started with a quote from Reverend Dr. Martin Luther King. This one is a bit more obscure, but unfortunately is relevant and speaks to us today. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Improving access to care in our rural, urban, and other vulnerable communities is a passion of mine and a goal of Element. We will orchestrate healthcare's digital symphony. Just please remember, our lives begin to end the day we become silent about things that matter. I want to say thank you to everybody for joining us at our virtual open house today. As Ms. McNair said, we will give you some time back in your day, and we look forward to working with everybody across the state in your community. Thank you so much.